Welcome back, everybody, to a Little Less Fear podcast. Today, I'd like to talk about what I'm calling the other side of grief, and this came about because of a guest that I interviewed on my podcast about grief in general. And in it, I shared with her one of my biggest griefs of losing a body organ and how it affected my life. For those that have been following me and those that have been listening to my podcast, you know that I've gone through a lot with my health in my life in these 43 years that I've been alive. And in 10 years of these 43 years, I underwent over 40 surgeries to keep my life sustainable and to keep basically just trying to survive and live to my fullest potential. And I have mentioned before how I lost my voice for 2 years and I had to learn sign language. I wore hearing aid, and it was very difficult for me to be losing my voice. And basically, I was becoming deaf and mute, and that was very challenging for me. And but the biggest thing that I've gone through that I don't often talk about because it was so impactful in my life, and there was so much grief involved in losing a vital body organ that I oftentimes see myself almost just not really wanting to talk about it. But I know that if I don't talk about it, it's not going to be very helpful for anybody. People want to hear stories, people want to know, and that they can connect with people in different ways. And so, in doing so, I'm going to share the story about how I lost my urinary bladder 9 years ago. So I was born with a rare genetic disease called Muckle-Wells syndrome. Muckle-Wells syndrome is statistically 1 in a million, and I wasn't diagnosed till I was 36 years old. I'm 43 now. So in between being born and 36 years of age, I went through a lot of health struggles, a lot of tummy aches. I didn't grow to my full potential. I didn't get to thrive. I stayed 5 feet tall. I stopped growing at like 13. I wasn't gaining weight. There was a lot of things that weren't in alignment for me health wise growing up, and it still continues to this day. But I can honestly say that I'm thriving now for the first time in my life. However, that was not the case just even 10 years ago. And the way it started with me with my urinary bladder, and this is again before I knew I had this genetic disease. It started at about 26 years old. And at 26, I was having a difficult time peeing, going pee like a regular person. Basically, what would happen is I would sit in the toilet. And for those that don't know, I'm transgender. In the first 34 years of my life, I was female. So when I say I was sitting on the toilet, meaning I sat down to pee at the time, I sat down to pee, and urine wasn't coming out. It wasn't expelling. So I would often have to push my urine out really hard, push. And it just got to the point where it became painful and my bladder area was burning. So I saw a specialist for the first time. I saw a urologist. I was 26, and the doctor had me try different medications, and he tested me over and over. I did not have a urinary tract infection. So he decided to scope me under anesthesia. And when he scoped my bladder at the time, he had diagnosed me with something called interstitial cystitis, which is an inflammation of the bladder lining. And it was so bad at that time, by that time, that even distending my bladder, distension meaning they would make my bladder bigger by either putting heavy liquid in there or and then expanding it to its maximum capacity. But when he did that, it was causing bleeding. So he told me that my case was very rare because it's very rare to have such an advanced case of interstitial cystitis at such a young age. So at the time, I felt a little discouraged. I was finishing my master's degree in psychology, and I was across the street from UCLA. The school I was going to was a private psychology school that was about 2 blocks away from UCLA. And I suffered for about 2 more years on medication that the doctor had prescribed me, hoping, I guess, that it would go away. But it didn't. It got worse. It got worse. It hurt to pee even more. And I had pushed to get any of my urine out. And I felt like I was going pee all the time. I had to pee all the time. It's as if I never went pee right after peeing. I just had the constant urge to pee at night, in the day, all the time. So I decided to, I had good insurance, good health insurance, and I decided to take myself across 2 blocks, which was at UCLA Urology, where I met an incredible doctor, Dr. Larissa Rodriguez, who became my primary urologist for the next 12 years about. She's now at Cornell University in New York. But at the time, she saw me and she said, well, I see, that we're going to have to do a lot of tests on you to figure out what's happening. So the tests were called urodynamic studies, where they would put sensors around my bladder, my pelvic area, and have me expel my urine. And it would test the speed, which is the velocity, the quantity, the quality of the urine, and the nerves, the muscles. It tested everything. So after a few tests, she saw that yes, the first urologist was correct, that I had an advanced interstitial cystitis, and she also noted that my pelvic muscles were not working. They weren't basically coordinating to expel urine. And so she decided she was also going to do a distension and under anesthesia and start all the tests all over again. So she did a few distensions and it caused me to bleed. And we did so many tests. It was test after test after test, distensions, and as time went by, things got worse. So I became a candidate for something called a bladder pacemaker. And it's also called Interstim. And I became a candidate for it. And I had the trial. I tolerated the wires that were implanted in my sacral nerves, my lower spine, and I went ahead with the surgery afterwards. So at the time, I was one of the first patients, I guess you could say, trying out for the first time this new device, this bladder pacemaker. And now I was about 30 years old. And it was very painful. I mean, I'm a small frame person, and this pacemaker was the size of, I'd say about 4x4, or actually about 3.5 by 3.5, something like that. And on a small, thin person like me, with there's 6 lead wires coming out of it into my spine. And so every time I would sit down, it would kind of like shove up towards my hip and into my spine. And it hurt. It hurt. And I had it for 7 years, 7 long years. I had this pacemaker. And basically, the way this pacemaker works is that it shoots electrical impulses to my sacral nerves to tell my nerves that are controlling my bladder to basically pee. And it would send these messages to my brain. So it helped about 30% of the time. And 30% was significant enough for me to keep it for 7 years or so. But things got worse for me. I wasn't, I mean, yes, it was helping 30% of the time, but my urine got less and less, meaning when I would pee, only a few drops started coming out, only a few couple drops. And it just got really uncomfortable and painful for me. My urethra was always in pain. I was in pain. I was miserable. So the doctor then decided, and this is again after so many different procedures and different trials and stuff, she decided that I was a candidate for a partial cystectomy. I cannot remember the actual clinical word for it, but basically what that is she made my bladder bigger, and by cutting my bladder in half, my native urinary bladder in half, attaching, I want to say it was about 20 inches of my small bowel intestine to the bottom of my native bladder to make it bigger so that it can hold more urine. And I knew that was going to be a big surgery. It was going to be a C-section cut, and that some of the things that could go wrong were that I might not be able to pee ever again. And if that happens, I would have to catheterize for the rest of my life. I knew the complications, I knew what could go wrong, but at the time I mean, it was the point of no return. My bladder was not getting any better. I wasn't able to pee and I was suffering a great deal. So I went ahead with the surgery. It was about 7.5 hours long. I did well. I did actually very well for about 3 months. I was peeing on my own, and it was a miracle for me when I started to pee on my own. I felt really blessed. Things I felt were kind of going up, and what I mean by going up, mean getting better, and kind of because I was able to hold a little more urine and pee on my own. However, after about 3 months, it my health started to deteriorate. My bladder health started to deteriorate. I started to get a lot of pain, and then I just wasn't able to pee anymore like a normal person. Actually, I just could not pee. Pee would not come out at all. So I then started catheterizing at the time through my urethra. And a urethra is your urinary hole. And so I began catheterizing, and I would catheterize 7 times, 8 times, 9 times, 10 times a day. It ended up being 10 times a day for a whole year. And by the end of the year, I was in so much pain. I couldn't even stick a catheter in my urethra anymore. It was strictured, strictured meaning it had tightened. There was scar tissue. It was very painful. Pulling the catheter out of there was felt like razor blades coming out. It was awful. And so the last resort at that time was to completely remove my urinary bladder and to make me a whole new bladder, also known as a neo bladder, NEO, meaning new bladder, entirely out of my small intestine, and creating a stoma, which is where I would catheterize through, and the stoma would be out of my abdomen. I knew the complications. I knew there was a long time healing with this, and I asked my doctor if she would do the surgery for me, and she said she would think about it. She wasn't too sure. I mean, it hadn't been done on anybody as young as me. I mean, not at UCLA. It hadn't been done on somebody that didn't have cancer. It was very rare to take somebody's urinary bladder out at such a young age without any other indication that wasn't completely life threatening, meaning I was on my deathbed, and I was not on my deathbed. But this was a quality of life issue. At this point, I couldn't even pee. And if you can't pee, it can definitely be an emergency. So after about 3 to 4 months of asking my doctor if she would do it, she finally agreed to do it. And she did it in hand with another doctor who had done this procedure many times in different countries, incredible Dr. Roz. And he recommended that I also remove my urethra. So the surgery would be removing my urethra, another 30 inches of my small intestine, creating a stoma from my appendix, and cutting my ureters, which are my kidney tubes, and reconnecting everything. We went ahead, and I had the second opinion with Dr. Roz, and he said that basically the turning point from there was him telling me, if you were my child, I would want this for you because you're suffering a great deal, and this is going to be best for your long-term quality of life. At that point, I knew there was no turning back. I had to go through it, whether it was my destiny or some kind of I don't really know what else to say about it other than that I had to go through it. And it was basically to save my life at that point. And so I went ahead for it, and I'll never forget it. It was November 23rd, 20 the year was 2013. I was 33 years old. And or was it 2012? One of those. 2012. Yes, 2012. This year makes 10 years. Yes, I was 32 years old. And so I went for it, and my family was there. My friends were there the day that I went for this incredible big surgery. They started off with an epidural to numb my lower back, and which is very painful. And I know women that have given birth know exactly what this injection feels like, except I'm not sure they really feel the pain since they're having labor pain. But the epidural is not fun. Let me tell you, it was very painful. more like pressure pain, not crazy pain, just like a pressure pain, I remember. And then they, got me all set up, all these IVs. I even had an IV on my neck. I had it everywhere. They were gonna get me ready for a crazy, crazy journey ahead. So I remember saying my prayers and saying my goodbyes to everybody. And I was very grateful that these doctors were taking their chances on me, these incredible surgeons at UCLA. And I really felt blessed at the moment. So when I woke up from surgery 13 and a half hours later, I I remember being in the most excruciating pain of my life. There was nothing that could have been more painful than waking up from having my urinary bladder removed and all the other reconstruction that went with it, cutting my intestines and my ureters and making a stoma out of my appendix. So much went on, and I also had three blood transfusions. It was a journey that I never knew I would go through in my life with that much intense pain. By the time I woke up, since so much time had passed, my parents were ready to leave. Everybody was ready to leave. They just wanted to see me awake. And I remember my best friend, my best friend Alfonso. He had just got there because he got out of work, and he was like, "Oh, hey, just glad you're okay. All right, I'm leaving." And I grabbed his hand, and I looked at him and I said, "Don't you leave me." So he said, "Oh, okay." And being the bestie that he is, he stayed with me overnight at the hospital, and I'm so glad that he did that first night because it was an awful night for me to experience. It would have been awful to experience by myself alone, and he was there to be an incredible friend. And I remember hallucinating because they'd given me ketamine, they'd given me morphine, they'd given me I was also still coming out of anesthesia. I had Dilaudid. I had Percocet, all kinds of pain medication running through me. And I remember hallucinating, seeing like an alien in my room and thinking and asking him if there was an alien or if that was a napkin holder or the tissue. And he said, yeah, it was the napkin holder. It was a really incredible 26 days that I spent at the hospital following that surgery. So yes, I spent Christmas through there, Christmas there, and right around Christmas is actually right around the time I was coming home. But I remember feeling, actually the most painful moment at the hospital was taking my first walk. And my mom was with me, and one of my former friends, my buddies, was with me. And so you have to walk. If you don't walk after surgery, it could be detrimental to your health. You have to have your bowels move in. By the way, I didn't have my first bowel movement till like I think it was day 12, day 14, something like that. And I wasn't able to eat till like day 13, 14, something like that. And it was pretty brutal. I didn't have a feeding tube yet at that time. I didn't have a feeding tube. That came a couple years later, but at the time I didn't have one yet. So I was starving. I was hungry. My mouth was so dry. And I mean, like the worst dry mouth you could have. And I didn't have a voice because after being intubated for over 13 hours, your vocal cords get a little damaged. So I couldn't really talk. I didn't have such a loud voice. So I was silently in some excruciating pain. And I remember the day that the doctor said I had to take my first walk, and there were six tubes coming out of me with about six bags, one bag holding my urine, another two bags coming out of my kidneys, another bag collecting blood, and another bag collecting urine from the other side, if I remember correct. I remember six bags, six tubes. And standing up, I couldn't stand up, and I couldn't walk for more than a few seconds. I just remember trying to stand up, and the pain was so intense I started crying, and then in turn it made my mom cry. And I didn't want to see my mom crying like that. I didn't like to see that she was hurting from me hurting. I knew that that was my journey that I had to go through, and I didn't want to pull anybody down during that journey. But I was just so blessed to have had my mother there and my friends. As I talk about this, I feel a little knot in my throat, getting a little emotional, and perhaps maybe this is why I hold back from talking about this, because of the intense emotions that it brought up for me at the time. And I'm not afraid anymore of a lot of things. And one of the things is I'm not afraid to express my emotions. And so these emotional tears that I feel right now are tears of triumph, tears of victory, tears of joy that I'm still alive, tears of gratitude that my mom is still alive, my father's still alive, my brother's still alive, that my friends are still there. Just tears of beauty. So it wasn't easy though after I got out of the hospital. I I went through a lot of grief, and a lot of the grief was at the time I was thinking I have a permanent disability. I have to catheterize through a stoma. I kept getting infections for years, for about 5 years. I kept getting infections all the time. I was in the hospital like every 2 weeks. I was getting kidney infections every 2 weeks. So I was constantly living in hospitals, constantly living in hospitals. And since doctors never had a patient like me that had lost their urinary bladder, and since I had so many infections, they would hold me at the hospital for a week or two sometimes, making sure everything's okay, making sure that I didn't have stones, making sure that nothing else was being affected. So I was at the hospital all the time for weeks at a time. And this constant hospital stays went on for about 5 years straight. And every time I would catheterize to pee, it would cause pain, spasms, and it would cause me to be very nauseous every time for about 5 years. And so I went through a depressed period. I went through a grieving period. I felt upset that I had gone through what I'd went through. I felt upset and jealous that people can go to public restrooms so easily without having to worry about it. Infections, I was upset that disability bathrooms are all the way in the back. How does that make sense? If you're disabled, the bathroom should be right at the front, not in the back. So I started seeing a lot of things that a lot of things that people with disabilities go through every day. And it made traveling complicated. It made me bedridden, made me homebound. I had a home nurse for 7 years actually. I'm very blessed to have had her, Jeanette Walton, for 7 full years. She was an incredible nurse and a light in my life. So I at least had her to come see me twice a week for that long. And she would help me with irrigating my bladder. She would help me with injections. She would help me with my wound dressings. It took a long time for my wounds to heal, having an opening and down your abdomen and a stoma. And I went through a big grieving process. So after having my urinary bladder removed, I my urine uh was supposed to be continent, which means I wasn't supposed to be leaking any urine. But for the first year, all my urine was leaking out of my stoma. So the first couple 3 weeks or so, I was bedridden with towels all around me because I didn't know how to stop the urine. It just kept leaking and leaking and leaking. And so the doctors weren't able to repair it for about 3 to 4 months. I had to wait for some healing time. So in between then, I started to experiment with urinary bags, urostomies, and I became very allergic to adhesive. So it was really difficult for the adhesive to stick onto my skin without me getting blisters, without me getting big rashes. And so I wasn't fond of these urinary bags, and I went through so many different ones trying to find the right urinary bag, and trying to avoid blisters and infections. And it was just I lost a lot of weight. I mean, I couldn't really walk. My muscles atrophied. So I became very much bedridden and homebound for many years. I um I really started becoming almost jealous at people's ability to pee. Like, oh, it must be nice. In my mind, I would think like, this guy's having a bad day. Oh, I bet you can pee. Oh, this girl's having a bad day. I bet you can pee. Like little things like that would come to my mind, and I just had so much pain, emotional pain, physical pain, traumatic pain, and I couldn't really see the other side of grief at that time. So Dr. Roz was able to repair my leaky stoma after 4 surgeries, actually, which was another about a whole year's worth of surgeries. He kept going to repair it, but I kept leaking. He repaired it and I kept leaking. And finally, on the fourth one, he was able to use my abdominal muscles to tighten the stoma. And that in turn finally healed me from constantly leaking urine. And then after about a year and a half, I was able to finally catheterize through my new stoma. And so then I was able to start a new life without the urostomy bag, without peeing on myself all the time, and being able to hold some urine for a few hours. I still leak now after about 3 or 4 hours, but I'm able to hold a good 3 to 4 hours. So I'm really blessed that I can go about my day doing some things, but I am on a time crunch for the most part for the rest of my life. And so I also want to talk about the other side of grief here, because once things started aligning for me, once I transitioned to my true self, being the man that I am today, and once I went through all the health journeys that I went through, losing my voice and having 3 masses in my larynx, a major surgery in my vocal cords. After going through all that and finding spirituality, finding Buddhist psychology, Buddhism, finding my higher self, becoming in alignment with God, with my true nature, my divine nature, my pure love nature, I was able to see the other side of grief. And the other side of grief is joy and abundance and acceptance and love and courage. And I'm now I just feel so blessed. I don't see myself as somebody with a disability, although I do have a disability placard, and I'm not ashamed to say that there is a disability that I live with. However, that word tends to have some fear attached to it, tends to have some what limitations. And what I see now when I see the word disability, I see the word ability. That's a longer word. I mean, disability, DIS, is so tiny compared to the rest of the word disability. And now I see that I've got an ability that others don't have. I have the ability to be more courageous. I have the ability to face my fears head on. I have the ability to pee a different way. I have the ability to trust my body in a way I never knew I could trust. I have the ability to thank my body for going through everything that it's gone through and everything that it keeps going through, and the resilience of this body and the cells in my body, my heart, my mind, my brain, my new bladder, the doctors that helped me save my life, the doctors that spent 13 and a half hours and more on me, on my body, to help me survive, to help me thrive. The other side of grief is an immense gratitude. Both words start with G and they are complete opposite. So I am in this intensity, intensity that I have within me. And I've got to thank all the doctors, all the fellows, the institution, UCLA, USC, um my own soul, my spirit, my friends, my family, just the love that I've gained within myself from losing this vital body organ has been so immense. I feel that this journey that I've gone through was meant to happen. I was meant to go through it. I was meant to suffer as much as I did, to be able to suffer with everybody else. And in doing so, I am able to understand and have compassion for so many people on so many different walks of life. For those that have lost their bladder because of accidents or bladder cancer, for those that women that have had cervical cancer, I've had stage 3. For those women that have had a hysterectomy, I've had a hysterectomy. For those trans men afraid to transition, I've transitioned. For those people afraid to go through surgery, I've gone through it. I've gone through so much in my life. I've lost my voice. I didn't talk for 2 years. I had masses in my larynx. All the stuff that I've gone through was to understand all of humanity. And I'm here to lift up humanity any which way I can by giving and extending a hand of joy, of love, of of just fulfillment. I am so fulfilled in my life, and I have all of you to thank. Thank you for listening. Thank you for your encouragement. Thank you for your support. And I hope that I can continue to be this light for people because everybody has been this light for me. The least that I can do is to uplift humanity. And I just want to thank you all so much. Thank you. I love you.